Naturally, malpractice exposure does not arise from a single moment in care. It develops through a sequence of clinical decisions, documentation practices, and risk management actions that unfold over time. This OUM briefcase publication examines how routine chiropractic care, combined with clinical judgment and post-treatment developments, contributed to a high-severity malpractice claim and highlights where risk management processes became critical. This case study involves a 39-year-old male patient who presented to a chiropractic practice with intermittent, work-related lower back pain and spasms reported at a severity level of 1. Care was provided in an outpatient chiropractic setting. Diagnostic imaging was performed, including lateral cervical, AP cervical, lateral lumbar, and AP lumbar X-rays. Based on the patient's presentation and imaging, a treatment plan was initiated that included chiropractic manipulation of the neck and spine. At the final visit, treatment consisted of a diversified technique and a cervical adjustment. The patient was positioned supine with greater emphasis on lateral flexion rather than rotation. A high-velocity, low-amplitude thrust was performed. Following the adjustment, the patient reportedly felt fine, was able to get off the table without complaint, and continued with other treatment modalities. No immediate adverse symptoms were reported or documented at the conclusion of the visit. The next day, the patient developed acute neurologic symptoms, including sudden onset of nausea, vomiting, dizziness, difficulty swallowing, and numbness affecting the right side of the face and body. He presented to a local hospital where examination revealed a positive pronator drift of the right upper extremity. CT imaging demonstrated a probable right vertebral artery dissection with distal occlusion and a developing infarct in the right cerebellum. The patient's condition deteriorated, and he was transferred by helicopter to a larger hospital. MRI imaging confirmed a stroke extending from the lateral medulla to the right cerebellum, and CTA imaging showed distal right vertebral artery occlusion. He remained in the intensive care unit for several days with daily CT scans showing stable progression of the stroke, followed by transfer to an inpatient rehabilitation facility. The long-term impact to the patient was significant. He developed paralysis of his vocal cords, required placement of a permanent PEG feeding tube, and reported that he was no longer able to work as a laborer. He was married with a young child, and his wife asserted a derivative claim for loss of consortium. Allegations against the chiropractor included improper chiropractic manipulation and the performance of unnecessary or contraindicated maneuvers. Additional allegations cited failure to evaluate for cervical instability prior to treatment, failure to perform cerebral vascular evaluation, and failure to obtain open-mouth X-rays to assess cervical instability. The claims focused on evaluation, clinical decision-making, and whether appropriate precautions were taken before performing cervical manipulation. The outcome of the case was driven by the severity of the injuries and the close timing between the cervical adjustment and onset of symptoms. Due to the potential exposure to a substantial verdict, the case was settled. This brief case highlights the importance of risk management as an ongoing process. Thorough documentation of orthopedic and neurological testing supports clinical decision-making and helps identify conditions that may require modified care. Tracking symptoms, documenting patient response to treatment, and noting any changes over time demonstrate active clinical oversight. Knowing when to proceed cautiously and when to adjust technique based on patient factors is critical. Clear communication, collaboration with other healthcare providers, and complete documentation strengthen both patient safety and defensibility. Briefcase is designed to help chiropractors identify how everyday decisions can influence malpractice exposure. Proactive risk awareness protects patients and supports the long-term stability of the practice. To learn more, visit www.oumchiropractor.com.